It is actually called as a pinnacle of support in critical care.
So it's basically like an artificial heart and artificial lung taking care of your body.
సో ఎక్మో మీదకి ఒకసారి వెళ్తే పేషెంట్ బయటికి రాడు అనేది డెఫినెట్లీ మిత్. కంపేర్ టు ఇంటర్నేషనల్, ది అవుట్కమ్స్ ఆర్ ఆల్మోస్ట్ బెటర్ దెన్ దాట్. సో దెర్ ఈస్ స్టిల్ హోప్ అండ్ వీ హ్యాడ్ వెరీ గుడ్ సక్సెస్ స్టోరీస్.
Welcome to the program, Doctor.
Thank you, Dr. Lakshmi, for inviting.
So, Doctor, healthcare technologies have definitely made some significant advancements in the past few years. And I'm sure that during COVID or post-COVID, there was one such thing which had gathered a wider picture is ECMO. So to begin with, what exactly is ECMO?
ECMO ante Extracorporeal Membrane Oxygenation, where it is actually called as a pinnacle of support in critical care, especially in ICU. As you told, it is clearly during COVID, it was very much the patients were landed up in severe respiratory failures, where the patients, even we were not able to maintain mechanical ventilation. That is the time then when we thought of ECMO. So we had a lot of patients at our Yashoda Hospitals also, where we managed most of them on ECMO. So ECMO is basically extracorporeal membrane oxygenation. That means when the patient is not able to maintain the oxygen because of severe lung failure or sometimes even cardiac failures, we take the blood from the patient, take out and process it through the machine, which goes through the membrane oxygenator, and it will be filled with the oxygen, and then it will go back again to the patient. That is how it is called extracorporeal, means outside the body. సో బాడీ శరీరానికి బయట మనం ఆక్సిజన్ నింపి మెషిన్లో ద్వారా నింపి మళ్ళీ దాన్ని పేషెంట్కి పంపిస్తాం డిఫరెంట్ క్యానులాస్ యూజ్ చేసి. సో దట్ ఈస్ కాల్డ్ ఎక్స్ట్రాకార్పోరియల్ మెంబ్రేన్ ఆక్సిజనేషన్.
So it's basically like an artificial heart and artificial lung taking care of your body.
Yes, correct.
So in what situations or in patients ECMO is typically used, Doctor?
Basically the patients, as I was telling about COVID pneumonia, and nowadays the COVID is not much in prevalent, but the more and more we had these season influenza pneumonias. So we had patients, pregnant patient also, so with influenza pneumonia, high risk populations. So because of which their lungs are pretty damaged and they'll end up in severe respiratory failure after we put them on ventilator, and sometimes we prone them. So prone ventilation, where we put them in the prone. But despite that, the oxygenation is not improving. Those are the candidates. So severe respiratory failure because of any pneumonia. And other heart conditions, as we were discussing, it's heart and lung support. The heart support, especially when the heart is not functioning properly, the conditions like even we see some patients who are young people kuda sometimes dengue affect dengue virus infection valla myocarditis ane picture lo land up avachchu, where severe airway dysfunction will be there. And there will be postpartum cardiomyopathy, ante pregnants after delivery sometimes they land up in a condition postpartum cardiomyopathy ani. So severe heart failure నుండి హార్ట్ సరిగా ఫంక్షన్ చేయనప్పుడు కూడా మనం ఈ ఎక్స్ట్రాకార్పోరియల్ మెంబ్రేన్ ఆక్సిజనేషన్ అనేది ప్రయత్నం చేయొచ్చు.
So basically ECMO is a machine which supports your heart and lung and then gives rest to your heart and lung when needed the most. So are there any different types of ECMOs which are used in different conditions?
There are two types of ECMO basically. So one is called VV ECMO and another is called PA ECMO. So VV ECMO means venous. That means you take the bad blood out and put we put oxygenation in that blood and again send it back to the another vein. So here only respiratory failure is involved. That means only oxygen is the problem. But when you need a heart support, we do a veno-arterial. That means we take the bad blood and send it to the arteries. Arteries means good blood containing blood vessel. Because you are bypassing the heart here, that means basically the intention of ECMO is to give the rest to the lungs and the heart. So the heart is not functioning, you are giving rest to that. The lung is not functioning, you are giving rest to that.
So once a patient is on ECMO, Doctor, how do you think he would be coming out of it?
Basically, always whenever any patient goes onto ECMO, the primary problem has to be resolved. That is the main important. Suppose a pneumonia, where a severe pneumonia affecting the lungs, generally we give at least 10 days to 14 days of support. So during this period, you will be giving antibiotics. You will be, if needed, doing bronchoscopies to clear out secretions, open up the lungs. So during this process, lung will heal. Once the lung heals, slowly the function will be taken over by the lung. The lung will be in a state where it will be able to function without ECMO support. So we look at certain parameters where we think the lungs are independently able to maintain the oxygenation. That is the time slowly we'll think of weaning the ECMO. So once we wean off the ECMO, we'll put them on ventilator. Slowly then we'll wean off from the ventilator also.
So I'm sure that ECMO being one of the recent technological advanced machine, there are many myths surrounding this because most of them do not know what exactly this is.
Yes.
And one such common myth is that once a patient is on ECMO, that the hopes of survival are very less.
Yes.
So how would you like to address this?
So I think a very good question, because most of the people think, it is a pinnacle of support when everything is failed, that you are going for a rescue therapy. So, but that doesn't mean that the patient who gone on to ECMO had very bad mortality or nothing but death. For example, I will want to share one success story of myself, where we treated one 16-year-old girl. She had severe diabetes mellitus. So because of which she landed up in DKA, and along with that, the DKA precipitation was severe lung failure. We had to wheel in that patient from Nanded to our center, because she had very bad respiratory requiring 100% of oxygen, FiO2, that's called. So once we brought her here, we put her on ECMO. She stayed on ECMO for 10 days. So after 10 days, her lung improved very well. So we could able to take her out of the ECMO. So ECMO మీదకి ఒకసారి వెళ్తే పేషెంట్ బయటికి రాడు అనేది definitely myth. Selection of cases, most of the times these patients where the reversible cause is there, the patient's success coming out of the ECMO is pretty much good. So that is the thing. I think we should practice more and more ECMOs. Even there is a concept called as ECPR, Extracorporeal CPR support. When all the conventional CPR fails, if you have a protocol in place, policy in place, and something like Yashoda, where we have a protocol in place, ECPR, once patient comes to emergency with emergency medicine, critical care and cardiology, cardiothoracic surgeon, we put them on extracorporeal CPR. So and suppose a cardiac condition is there where stenting is being done. Once stenting is being done, the cardiac function improves. We will be able to come out of the ECMO support. The patient may recover. So this is how the ECMO is evolving. The technology is evolving more and more. There is a organization called Extracorporeal Life Support Organization. We call it as ELSO. Our Yashoda Hospitals is certified, and we are working in association with ELSO and sharing our data. So we have ECMO. I think everybody knows heart lung transplant unit there in Secunderabad. So I think more and more ECMOs have to be practiced so that we'll have good results, especially I can say in at least young and middle-aged patients.
So I think that's really inspiring story what you have shared, and I'm sure you have many to share as well. So what stands out about our center's approach to ECMO in critical care support, doctor?
So being I can say a quaternary centers, I can say not even tertiary, quaternary centers, we have a very good multidisciplinary approach and everything in place, able to do ECMO quickly, and because of which, if you are, the time matters while initiating any ECMO support. So regarding that, we are regularly brainstorming how can we quickly put the patients on ECMO. So regarding that point of view, I think our center stands out, and we do have a very good monitoring, and we have almost, I can say, compared to international, the outcomes are almost better than that. So I think more than 50-60% of the patient have come out of the ECMO support.
So thank you, Dr. Kaladhar. It was wonderful interacting with you. So before we wrap this episode, is there any message that you would like to share with the viewers out there?
Don't think that once we tell about ECMO, it's the end of the story. So there is still hope, and we had very good success stories. Probably everybody think towards it, and whenever there is ECMO, I think you can ask more questions, clear about it, and then go for it.
So this brings us to the end of this episode. Hope this episode was both inspiring and informative on the topic ECMO, and don't forget to join us for next week as well. Until then, Take care and stay healthy. Thank you.